how protocols are duly observed. My name is Noya Lemokoli, and I'm the Chief Operating Officer at Lead Space by Passion Incubator. So we hosted the community discourse on the future, on shaping the future of healthcare and wellness. So our Lead Space is a co-working space, and then we support tech startups that are literally leveraging technology to scale different sectors of the economy. And we also run Passion Incubator. So Passion Incubator literally works with DFIs, government, institutions to support young entrepreneurs and startups. So Hub One, that actually hosted the community discourse, is currently owned by FCMB, and Lead Space by Passion Incubator literally manages the hub. So based on the community discourse that we had 4 speakers, and it was very intentional for us because we needed to bring young entrepreneurs that are leveraging technology to disrupt the healthcare space. We had Dr. Wale Adeosun, the CEO of Wellvis. So Wellvis is literally a platform that provides an on-demand information and services to young people and to those who need medical attention. And then we also had Dr. Adora, who is the Chief Operating Officer of Oncopadi. So Oncopadi is a platform that simplifies access to cancer care. And then we also had Oshinaike, who is the CEO of Call Officio. So Call Officio is a platform that helps people get on-demand access to physiotherapy. And then it was literally moderated by a venture builder, Josh Opata of Mest Africa. So I'm pretty excited about this conversation, and reason being, I understand the need for PPPs in terms of public-private partnerships, because for the past 4 years working in the tech innovation space, I've seen how young people are able to leverage technology to provide solutions to some of imminent problems that we have in the nation and the United States. So based on the conversation we had, we analyzed what is the future of healthcare. So to summarize it, first of all, we analyzed the ability to leverage data to predict illnesses or diseases, ability to leverage technology to deliver quality healthcare service, as well as being able to have quality and affordable healthcare for all. So we actually talked about the challenges and then the solutions. I really don't like dwelling on challenges, but we just had some key points that were probably some obvious challenges. First, which is the healthcare space is pretty new, and then a lot of learnings, a lot of research and development needs to be put in place. We understand that to an extent, there is an inaccessibility of quality healthcare, as well as lack of sufficient healthcare personnel, as well as poor healthcare infrastructure. And this was to an extent manifest when the COVID pandemic started, and then we literally didn't have the infrastructure at that time. We then had to create some of these infrastructures. And to an extent, if we had these infrastructures in place, we're able to predict pandemics. To an extent, some of the risk or the consequences would have been mitigated. So we also dived into the possible solutions. So first is, how can Lagosians have quality insurance scheme? Okay, I'll round up. So also patient empowerment, being able to invest significantly in research and development, PPPs like I had mentioned earlier, being able to create a long-term blueprint with all stakeholders involved, be it healthcare personnel and then government, and then being able to create healthcare infrastructure and training of healthcare workers, create more cancer screening centers, and create favorable policies to enable innovators and young people innovate around the healthcare space. So, to an extent, if we, solve some of these challenges, millions of deaths will be prevented per annum, and there will be increased trust in the healthcare system. Nigerians will no longer need to travel abroad to seek medical attention, and then prevention of diseases and infections would be made manifest. So in summary, the future of healthcare is to be able to provide safe, efficient, accessible, and affordable healthcare service. Thank you very much.
So thank you very much, and welcome everybody to this session on health and improving the health systems in Lagos. Let me start the session, and thank you to the previous presenter to get that perspective from the youths. Let me start by introducing my colleagues on the panel. We have Mrs. Claire Omotseye, who is the founder and MD of JNC International. We have Mr. Abasi Ene Obong, who is the CEO of 54Gene. Ms. Deola Ali, the CEO of One Health Nigeria, a telehealth company. Mrs. Judy Vardell, Executive Director of Kukuza Incorporated. Mr. Tosin Rushewe, the CEO of Afia Care Nigeria Limited. Dr. Caroline Jehu Apia, the Deputy Director Health, Nutrition and Eradication at the Bill and Melinda Gates Foundation. And the moderator is Dr. Fisayo Okusonya, who is a health economist. So permit me to set the tone by presenting a few slides of the state of health in Lagos State, and then I will hand over to the moderator to take the panel's perspectives, and we'll go to the distinguished colleagues who are in the room with us today, all from very important walks of life in terms of the relationship with health. We're very happy to have all of you here today to contribute to the this very important discussion. Thank you. Can I have the first slides, please? So we're looking for the Lagos of our dreams, shaping the future of health in Lagos. One thing that we do recognize is the bulging size of this megacity. And, you know, all megacities are accompanied by a very high level of toxicity, stress, and biosecurity threats. So this is a recognized phenomenon. In the next 20 to 50 years, Africa is going to be a continent of megacities. Next slide. And for us here in Nigeria, we're very cognizant of the expanding population of the country, and very importantly, the inward migration to Lagos or through the southwest to Lagos, which is something that we really have to contend with in terms of overcrowding and the footprint of the continent. So when we look at the health sector, the government public health sector, we're looking at various healthcare delivery systems, innovation research, leadership and governance, human resources for health, the health services itself, health financing and health information systems, and biosecurity. And what we're doing in the ministry is to identify the gaps in this spectrum of necessary activities for the role that the state plays in setting an enabling environment for the delivery of good healthcare systems. Next slide. So this is the fundamental principle of health in Lagos. We have the population. The population are supposed to be catered for by the primary healthcare sector. And then there's an onward referral hierarchy system that goes through the complex healthcare systems to the secondary or to the tertiary systems. And the same thing applies in the private sector, because it's, you know, you go to your family doctor and your family doctor refers you to a specialist. The problem with our system, if we just go back one slide, the problem with our system is that the primary healthcare delivery system is not that well developed in Lagos. We're spending a lot of time and energy trying to get that into a formidable hierarchy of healthcare delivery in concert with the Lagos State Health Insurance Scheme. So many people are bypassing the primary healthcare facilities and overcrowding our general hospitals. Next slide. So the theory of change for us, at the moment, we see the Lagos State health system as a totally dependent sector on budgetary allocation. We see health facilities are not fit for purpose and are regarded as cost centers without revenue generation. There are inefficient systems, lots of wastage, poor quality care, poor health indices or sluggish health improvement on our indices. And what we want to transform into is a health is able to offset some of its expenditure, become a health neutral entity. Residents of Lagos State should have access to good quality care, a referral system, introduction of digital care and emergency medicine in the state. Next slide, please. So we're looking at a spectrum of activity. How do we build a resilient health system? We have to look very carefully at health financing, health system planning and governance, and of course, health systems delivery itself. And we're addressing each and every one of these sectors independently. Next slide. So health financing is key. We can't just depend on the government to keep producing the budget for us to deliver the needs that we need to do. We need to look at the insurance scheme. We need to look at the private sector and public-private partnerships and build into the health structure across the public and the private sector an efficiency and effectiveness, and not just a reliance on government budget to provide the health of the nation. The government is just an enabler, a policy setter and a public protector. And we need to look at these factors in concert with the private sector. Next slide, please. So we know that Africa is seeing a rise in incidence of emerging infectious diseases. We know there's COVID looming, there's Ebola in DRC, there's Ebola in Guinea, we have Lassa fever, we have monkeypox, and we are expecting pandemic flus and other kinds of emerging infectious diseases. So as a state, we need to be ready for these, and as a country. Next slide. So we are all familiar with the pandemic spectrum of pattern. You know, a pandemic comes with a first wave, it then comes as a second wave or as a third wave. You know, and in between these waves, you know, what are we doing? And in between pandemics, what are we doing? So we need to ask ourselves those questions. Next slide. So what we do as a state, we talk about flattening the curve, and if you see the curve on the left-hand side, the red curve shows, you know, a peak of cases from a pandemic that overwhelms the health sector. But what we want to do is go into the green sector where the number of cases that present is within the limit, within the capacity of our health infrastructure, and with time, that capacity improves. So you can see the dotted line is increasing over time. Next slide, please. So we're looking at how Lagos State plans to turn itself around. Our strategies are hinged on 5 critical principles: the ability of the state to anticipate shocks and threats, the ability to mitigate them when they happen, and those shocks and threats can be short-term, intermediate, or long-term. The adaptation, how do we adapt our strategies to absorb both these fast and slow shocks? The learning, what are we learning from the process of what's happening? And building resilience into the system based on the learning and the adaptation that we've acquired during the process of both acute and long-term shocks. Next slide, please. So very critical for us, what we've learned in Lagos is that COVID has opened our eyes in terms of the lack of the medical industrial capacity and innovation. To be able to confront a formidable force like COVID-19, we have to have a very robust research and innovation pipeline. We need to have foreign direct investments. We need to be able to collaborate with local and international partners. We have to open up to the private sector, and we have to ensure that there's increased investment in the health sector and improve our health outcomes. Next slide. Finally, we have a social contract with our residents in Lagos. You know, the Lagos State government provides an enabling environment, protects its citizens and provides a safety net. In return, residents of Lagos must give us some kind of authority to carry out these enablers. Citizens must pay their tax, they must respect the laws, and they must accept civic obligations. That is a social contract that we have. And before I end, one thing that we're very keen of in Lagos State is the One Health concept. And the One Health concept talks about human health in the context of the environment and the agricultural systems that we operate in our state. And the WHO is moving us away from operating as a silo to operating as a continuum. COVID came out of the environment, Ebola is coming out of the environment. Our environment is toxic, the food we eat is important, we must make sure there is a food chain integrity. And critically, in Lagos State, we're very acutely aware of increasing slum settlements as a result of massive inbound migration. And that's something that we must address because it poses both a public health, an economic, and a security issue for us in Lagos State. Next slide. These are just images of our infrastructural blueprint for Lagos State. This is what we call Mr. Governor's medical infrastructure transformation. We're moving away from adopting buildings as medical facilities to designing facilities with international architects and local architects to produce a fit for purpose, both for an improved patient experience and improved health workforce experience. Next slide. On that note, I thank you and I'll hand over to the moderator.
Thank you, Honorable Commissioner. So I just want to confirm before we start, because there's actually 6 panelists in this session. I want to confirm that the other 3 panelists are online right now. So if you are online, I'm just going to say you should unmute your mic and just say hello, so we know you are online and we know how to direct those questions right before we start. So is Abasi Enobong, are you online? He's not online. Okay.
I am. Can you hear me?
Ah, okay. All right. All right. Okay, so I'm going to, is there any okay, you're online. I see you. We see you now.
Yeah, hi.
Okay, fantastic.
Hello, everyone. This is President Rishawe. I'm online as well.
Okay, thank you, Tosin.
Hi, this is Caroline Jehuapia. I'm also online.
Okay.
Good afternoon, everyone.
Thank you, Caroline, Abasi, and Tosin. So we are, this is going to
Hey, good afternoon, Josiah. Aeon's online. Everybody, G.
Oh, all right. So this is going to be a very robust discussion because we're all here. And I'm going to start immediately leveraging on the presentation of the commissioner. I want to start with Tosin because I want to pull the online team here. So Tosin Ronshaw, this is for you. The honorary commissioner clearly, alluded to some gaps in the healthcare system or in the health delivery system. How do you think that Lagos State can build an integrated healthcare system that can provide ease of access to patients at every level of care?
Thank you very much, and good afternoon again, everyone. I think the Honorable Commissioner has really set, the tone for the discussion around, what the vision is, for Lagos State. And for me, that vision is to transform healthcare provision and make the state a hub for medical services in Nigeria, in West Africa, and all of these, I believe we can achieve within a decade and a half. And what does it mean? Practically, it means that we can position Lagos to become the geography for accessing medical services that it will be good, not just enough for Lagosians and Nigerians, but perhaps for West Africans and all Africans who do not, have enough money to go to the Western countries or who do not want to undertake the very long and tedious journey to South Asia. And in order to do this, I think there are clearly imperatives, a lot of which the Honorable Commissioner has talked about. He talked about the slum settlement, so I would call that, public sanitation, the need for us to improve public sanitation, as 60 to 70% of the disease burden is primary. We need to raise our regulatory standards and enforce this, to ensure that, the quality of medical outcome is actually high. We'll talk about infrastructure, human resource, and of course, the starting point for all of this is universal health insurance coverage, which Lagos State government is clearly leading on in Nigeria. The improvements to be made yet, but it is a massive step forward, and I want to congratulate the state, for taking this step. So for me, very quickly, two imperatives: infrastructure and people, imperatives. And when we talk about people, infrastructure first, we have 5 beds per population of 10,000. This leaves us with a 400,000 bed, gap in the country, and when we compare this to the global average of 15, doctors per population of 10,000 people, and 28, in the Western countries, we can see that we are really, really quite far. Even India has, 8 doctors per population of 10,000 people. It's the same story for nurses. In nurses, again, we have 15 compared to the global average of 33 and 83 in the UK. So clearly, there are two significant areas that we need to transform. We need to transform the infrastructure. We need to transform people. By some estimates, the United Nations, projects that Nigeria will have a population of 260 million people within a decade. At least 10% of that population, will be in Lagos. And clearly, we will need to have in the country about 400,000 doctors, within that decade. Today, we're producing 3,000 doctors annually as a country, and we have over 2,000 doctors emigrating abroad. So we're in a crisis situation. We are in a crisis situation. And for me, the starting point would be, in order to bring about this transformation and to bring about the vision that the commissioner has talked about, we need to go into some basic, building blocks. We need to look at the issue of producing medical personnel. Whether we're talking about doctors or we're talking about nurses, we need to look at, all of the issues, including legal. Is it the Medical and Dental Practitioners of Nigeria Act of 2004 that we need to amend? Is it the NUC regulations? We need to increase the number of doctors that we produce. India had 110 medical schools in 1980. Today they have 532, producing 500,000 doctors annually. In Nigeria, we have less than 40 medical schools. We're producing 3,000 doctors annually. This has to change. And it's not just about the undergrad becoming doctors. It's also about the residency training. It's about the consultancy training. And all of these things, I think we need to pay a lot of attention to. Also, if I may talk quickly about infrastructure, and I think, again, the Honorable Commissioner talked about, the movement between your clinics, your primary healthcare center, secondary healthcare center, tertiary healthcare center, etc., and the fact that this really isn't working so well. We have really only about 10,000, about 10 beds, per facility in Nigeria, and this means that we are a highly fragmented, healthcare system. With a highly fragmented healthcare system, we are not going to have a facility, all of the multidisciplinary medical services, the diagnostics, and the quality or the expertise of consultancy that you need to have to guarantee a decent level of medical outcome. So again, can we look at this and say, how do we begin to question this area? How do we begin to look at this fragmentation? How can we start the consolidation of healthcare in Nigeria? Just to give some perspectives, Apollo Hospital that so many Nigerians go to in India has over 12,000 beds, one company. Mediclinic in South Africa has 11,400 beds spread across South Africa, Botswana, UAE, and Switzerland. And in each of those 4 countries, it is the largest healthcare provider. Ardor in Brazil has over 10,000 beds, and it's not even the biggest hospital company in Brazil.
All right.
So, when we take a look at all of these things, I think there will be quite a lot to talk about.
So I have a follow-up question to that, and I'm going to ask it, and I want you to think about it while I go to some other aspects, because I want you've made some very valid points and said we should focus on 2 things, infrastructure and people. But there are real constraints to achieving those things. So I'm going to ask this follow-on question. You can think about it. So when I come back to you, I like such a robust answer like you have given just now, right? So the commissioner mentioned some very interesting principle in his presentation, which is the Overton window, which is to say that after COVID-19 has come, and like Churchill said, you should never waste a good crisis, right? Now, given that, what policies from the policy level need to be put in place to achieve some of the things? You talked about the residency program, you talked about all those things that would help us achieve. So I'm going to come back to you on the answer to that. How do you think from policy downwards we need to change our setup to be able to achieve some of those large number of beds or hospitals or task shifting or sharing or whatever it is? Is that all right, Tosin? So I'll come back to you. Thank you.
Yes, thank you.
Thank you so much. I have a question for you, Claire. So COVID-19 has come, and I mean, clearly, you saw that presentation, it showed some gaps in our healthcare system. And how do we effectively leverage this pandemic? Commissioner sort of talked about leveraging the pandemic. How do we effectively ensure that this pandemic will lead to us building a more resilient health system?
Thank you, Fisai, for that question, and also to the Honorable Commissioner of Health for setting the stage. I think most of us here, the word COVID-19 is not foreign. Everybody knows exactly what it is. And it's been a big Herculean task for governments around the world. Now, there are a lot of negatives, but I would like to talk about the positives. So I see a silver lining in the pandemic that has hit the globe. The first thing I think is that it has put healthcare on the map. There's been a lot of lip service to healthcare by governments around the world. It's been something that is used in politics, but unfortunately it's only rhetoric without action. What I've heard from the Honorable Commissioner here is that a government that is very serious of making sure that healthcare is not just lip service, but becomes a major contributor to GDP. If you look at GDP in the US, healthcare plays a major role. In our country, it's infinitesimal. We've also seen the direct correlation between healthcare and economies. Now, prior to this, we'd have to go begging and borrowing and asking our leaders to please give us healthcare budgets. But as it is right now, healthcare is at the top of every leader, every economic discussion, and that's why we're here today. So what are those things that it has done for us? It has unfortunately exposed the fragility of our system. As the last speaker said, healthcare in our country is very fragmented. We have a lot of small players in the private sector. We have government, the general hospitals, and teaching hospitals. At the end of the day, we're not able to make the kind of impact that will give us access to quality healthcare, to make a difference and make us the real mega city we want to become. As a Lagosian myself, having lived here for several decades, I think for me, I would like to see a future where you have exactly what you see in any part of the world in our country. And to be able to do that, it means that we have to harness all the opportunities we have. And I think for me, the big thing is exactly what the Commissioner said, is that we need to take advantage of the private sector. So the private sector has its efficiencies, it has its access to capital, it has its innovations, it has technology that can be brought to bear. And we can bring in disruptive models. But the challenge we see at the moment is that we need to have a dedicated PPP policy for healthcare. Lagos State does have PPP policies. It is making some impact. But if we have one dedicated to healthcare, not for building bridges or toll gates, but specifically for healthcare, that understands the indices and the fact that there is a social part of healthcare in addition to the business part. We need to go from being a consumer to being a contributor. And healthcare is no longer about a social service, but it is a necessity to be able to become a mega city. Now, what are those things that we require? We need an enabling environment. And as the Commissioner said, government's responsibility is to create an enabling environment. Our responsibility in the private sector is to take advantage of those incentives, those policies, the framework, and the regulatory environment to make the exponential change that is required. And these are things that I think that COVID-19 has been able to help us find. We also need to think out of the box. Gone are the days where we look for money from government and what can government do for us. It is also important for private sector, both private health sector and private sector, to come together and do innovative financing. So how do we pool financing? How do we do domestic resource mobilization? How can we use sin taxes or luxury taxes to pool in funding, to fund a system where everybody has access to insurance. Insurance is a key driver of access to healthcare. In Lagos State, there's a law. It has become mandatory, but we have to find a way to ensure that we can fully implement it. And I think COVID-19 has shown us that healthcare is not a luxury. Access to healthcare is a necessity, and we need to find a way to disruptively fund it, because when we have a poor population that cannot fund their own healthcare out of pocket, it becomes an issue. Our out-of-pocket expenditure is pretty high, anything between 70 to 90%. That's not sustainable for a mega city. So disruptive innovation, disruptive financing is important. We also see sometimes that there's a conflict between government policies. There's conflicting government policies which do not necessarily help private sector innovation and pooling of funds. And therefore, it's important that private sector is brought to the table where there's an open discourse on a regular basis with the leadership, both at the level of the ministry and at the level of Mr. Governor. So we can collectively devise those policies that are going to open up and unlock the potentials of both the public and the private sector. I also think that the ease of doing business is something that we can work on. There's a lot of issues. Some of them are federal, but some of them are state. Those that are state, we can find innovative ways to provide incentives, for example. Now, when I say incentives, what I mean both physical and non-physical incentives. Provision of land. Lagos State provides the land, private sector provides the building, provides the equipment. We do long-term concessioning, and this is the way to go. We need to have concessions that are not short-term in nature. They're more medium to long-term, 25-year, 50-year projects that can really make the impact, but have a vulnerable element that we are able to look after those who unfortunately can't pay for healthcare. So these are some of the things that can be done, and it must be done at all tiers of government, healthcare, at the primary, at the secondary, and the tertiary. Just to give an example, at the primary level, for example, Lagos State has in excess of 300 primary healthcare centers. Some of them are in different states, moribund, some are in great states. But if we get primary healthcare right, at least 70% of the challenges we have with access to quality healthcare are sorted. I looked at those beautiful designs that the commissioner put there. That is the way to go. Self-sustaining, green, properly built primary healthcare centers with a focus on prevention as against cure. A lot more prevention. People know that they have to think of their wellness, and that is the way to go. That could be taken over. We could do PPPs with primary healthcare centers. It's already, the pilot I know has started, but we need to be able to scale that up, leapfrog from where we are today, and take over and make sure all 300 plus primary healthcare centers are working at tip-top efficiency.
Okay. So
24/7 deliveries, immunizations, everything.
Okay, so I like the direction. What I hear you say is that if healthcare is going to be a contributor, then there needs to be investment from government and private sector.
Absolutely.
So I'm going to come back to you on a follow-on question as to dealing deeper into healthcare as a contributor to GDP of the states and also IGR of the government and all that. I'll come back to you with that. Let's take that direction. Judy, are you there, Judy? Is Judy?
Yep.
Okay, thank you. So, if you watch closely the commissioner's presentation, he talked about 3 pillars in focusing on resilient healthcare systems, right? He talked about health financing as one.
We're not covered by
Hello,
any form of
Judy.
health insurance, and the funding is still very much coming from the national health insurance, or it's coming from the employer. So there isn't.
Hello, Judy. Can you hear me?
Yes, I can hear you.
So we lost you for a while there. So
Okay.
I'm going to come back to you. I'm going to come back to you shortly. I'm going to come back to you. Give me a few minutes. I'll come back to you. We have one other panelist. Deola was answering a question. I'll come back to you so that we can hear your thoughts fully, because I have 2 or 3 other questions to follow on from your answer. So Deola.
So look at different access touch points that we're having issues with in the healthcare system. So awareness, for example. Are people aware of what they have? Do we have online questionnaires? Because everything now is we're utilizing technology, and this is the question, right? So do we have online access to questionnaires? want to, okay, do you have this, do you have that, and valid information, not information overload that will cause anxiety on conflicting information, right? So do we have access to understand that, okay, fine, this is a verified, like I really, really love the NCDC for Lagos State, and I go to CDC. So things like that, do I go there to verify that this is what is going on with me? And then when we do that, what about diagnosis? So what telemedicine, and I appreciate the fact that a lot of solutions are coming up that I'm super excited about that, including what we are doing at One Health. So what telemedicine allows you to speak to people online, right? What algorithms, what data can you input that can easily allow you to speak to them and then get the diagnosis for you to get the right prescription? So when you get the prescription, can you then get your medicines online? Can it be delivered to you, right? What online technologies, how do we verify? How do you use, technologies like blockchain to ensure that there's integrity along the supply chain for medicines? And how do we get that quality to deliver to your doorstep, for example? So I think of medicines, and I think of adherence, right? Adherence is a major problem because in where I practice right now, I have people that go like, yeah, my blood pressure is high, I'll just take it for 3 days. I know what I do. And then they come back again with the same problem. And this is because they do not know the importance of adherence. So how are we tracking that physically? Maybe they can't come to your pharmacy anymore as they normally do. So what kind of follow-up methodologies do you have? Do you send them reminders? Do you have somewhere they can log on for them to track the information? Do you have a really high dashboard that says, Madam, last week you missed your drug. If you miss this consistently 2 days, this is what is going to happen to you, and you need to adhere to your medication. So how are we using technologies like that? And then when you move from adherence, right, then you want to ensure that there's follow-up. So how are we following up with them? This is using tools and digital technologies, right? So this is just in terms of care. And obviously, there's a lot of, we can talk about AR, VR, facial recognition. Right now, you can actually get eye prescriptions online, right? You can speak to your doctor online. I already mentioned that. So those are kind of technologies that we're looking at. And obviously, research and development, very similar to what Commissioner said, right? How are we ensuring that we are not a reactor, right, to situations? What is the pipeline that allows for us to think, okay, we know Ebola has happened, we know COVID has happened, we know that this is pandemics will never, maybe 20 years, but something will happen next. What infrastructures, what research and development, how quickly do we have like the disease control team, and how are we empowering them to keep on learning and reskilling so we're prepared for the future? So, and there are different technologies that are evolving right now that we can utilize. So 100%, I think this is really a great eye-opener, and it allows us to really understand where we are and how we can definitely improve in the healthcare system.
Thank you, Deola. Before I ask Judy this question about the system, I want to see if I can take one question from the gallery. If there's any question, maybe you prepare your question, I'll give you, and I'll go and ask and come back. Because I'm just delving now into the sweet part of this. So I'll come back to you, but I'll be taking questions after Judy answers. So Judy, sorry about that. Are you here now? Are we here?
Yeah, I'm here. Okay.
Fantastic.
I'm here.
Yeah, so where I was
and I'm hoping.
Thank you. Where I was going with that, before you answer, is that the Commissioner mentioned 3 clear pillars: health financing, health systems planning and governance, and the health delivery system itself. Right?
Sure.
So the question I have is, in terms of health financing, right? You know how far Lagos State has come with health financing. What needs to be done to achieve the health financing system of our dreams, which for us is health insurance, and still have a system that takes care of the poor?
Sorry, I've lost the audio there. Can you hear me?
Yes, we can hear you.
Okay. So it was around, and I wanted just to finish on this one slide. I'm happy to share this deck afterwards. But there was a study done in Lagos, published 2 years ago, which was looking at health insurance. But there are key things that I think we should be pulling out of this. Firstly is understanding who is not purchasing health insurance or has not got access to health insurance, what they're spending it on, and therefore how do we further attract them. So if we look at health shocks, however you want to call them, do affect you much more if you're not insured. Fact. I'm a firm believer that you should pay for healthcare services. There's 2 reasons for that. Firstly, one is I perceive value in that service, and there is then a service, we're exchanging a service between us. but it also then gives me the ability to query my healthcare. So if I'm not getting a good service and I've paid for it, then there's a quid pro quo that sits with that. And again, you don't want that to be a total barrier to entry, because we know that if you access healthcare services earlier, you have better outcomes. So my challenge is here, and this is the red text on the right, is how do we target the messaging around health insurance better? In other words, we don't just target the head of the household. How do we target men versus women? How do we target low-income earners versus higher-income earners? How do we target people on different socio-economic bases? I don't think the promotion of health insurance is necessarily a one-channel communication. Again, the slide before talks about nearly 60% of people, I think it is, have not heard, half of the respondents in that study have not heard of health insurance. That to me is then a concern. So I just want to get back to that slide. So that's around it. The other thing is, how do we ensure persistence? And I've quoted a study down at the bottom, which is around 3 ways around health financing. Most of them were settled in Nigeria. But in that was published in 2019. He said 86% of people he interviewed in one of those essays were intending to purchase health insurance, but only 24% had purchased just 5 weeks later. So I think there's something in around that. I'm not going to go through into the stats around it, but I think we've started to talk about it. But digitization is everything. I was on a call yesterday around the digitization of healthcare and medical technologies. It's a strategy that the NHS is deploying in the UK. Stat, 99% of doctors' visits pre-COVID were face-to-face. Post-COVID, 95% of those visits are now virtual. So we have an ability now. People are learning to engage. They're engaging via virtual technology. They're engaging. How do we accelerate that? We can give more care to more people quicker through the digital technologies. We were talking about healthcare infrastructures earlier. Pre-COVID, the Nordic countries were actually stopping building healthcare facilities because they wanted to push more care into the homes. So how do we do that? How do we look at what telephone people have? How do we look at what their needs are? How do we ride that wave of learning to be digitized? The other around, again, healthcare infrastructure is designing the care around the patient as opposed to, or the service accessor, as opposed to the traditional ways that we've done it. And then there's just one. Sorry, my mouse is very, very sensitive here. But the last one, and I think, Honourable Minister, this is what you had on your last slide, and I'm very, very pleased that you did it. There's a lot of environmental things that come around healthcare as well. So just by throwing money at the problem doesn't necessarily mean that we're going to improve the healthcare of people in Lagos. There's things here around how do we change lifestyle-related causes? How do we get people to act healthier, be healthier? How do we get health-seeking behavior into the communities? How do we set small businesses up to say, okay, you go ahead and help your community, get a small community together who say have diabetes. You earn funding off that, you're getting a healthier population in the process. Very, very quickly, Mr. Chair, I think I've covered most of what is in here, but I think for me, there's 3 main points. We've got to target our communication around insurance very differently to tailor to the markets. The second one is digitize, digitize, digitize. It's cheaper, you can access more people, you can provide broader care. The third one then is around, I forgot my point there, but the last one here is what I'm talking about here. How do we get health-seeking behavior into our communities? Because it's going to cost us less than insurance, in terms of the insurance funds. How do we work that all out? So I've finished my bit there, Mr. Chair. I'll hand back to you.
Thank you, Judy. So the third pillar, which is the health delivery system, I want to talk to Caroline. Caroline, are you there? Caroline?
Yes.
Fantastic.
I've just unmuted myself.
Great, Caroline. So I want to ask you, in terms of funding and mobilizing resources for the health delivery system, how do we achieve sustainable resource mobilization systems for our health delivery system in Nigeria, as in Lagos State, especially given the fact that you know that we are in a resource-restricted setting?
Hello? Can you hear me? You dropped off.
We can hear you.
Yeah, could you please repeat the last bit? You dropped off for a bit.
So I was saying, how do we build sustainable resource mobilization systems for our health delivery system, especially given the fact that we are in a resource-restricted setting?
Thanks. And thanks so much for giving me the opportunity to participate in this important panel, which I think is actually quite timely. Timely because we are a year into the pandemic, and, although globally we are in the same storm, we are not in the same boat. So it's important that we take time to kind of pause, take stock, reflect, and also reset. So with regards to sustainable financing, just to digress a little bit. So the foundation has been in Nigeria for the past 10 years. We've invested over $1 billion into the healthcare system. And of course, our priority areas include polio eradication, everything along the RMNCH spectrum. We've also had an excellent working relationship with partnership with Lagos State. It holds a special place in our hearts because when the foundation started engaging in Nigeria, we started from Lagos. So with regards to sustainable financing, as a donor, having worked in different countries, I think the key thing to ensure sustainable financing is to make sure that health is a political and investment priority. And in countries where they've seen some relative advancement in health outcomes, this has been the case. Health has been prioritized. I mean, as has been said by previous speakers, Ebola and COVID pandemic have been wake-up calls to indicate that we've been underinvesting in health systems. And truth be told, Nigeria invests too little in health compared to its peers, kind of punching way below its weight. And even though Lagos is a little above in terms of state allocation to health, it's still below the Abuja target declaration. And this low allocation to health is really worrisome because, as has been said by Claire, there's a direct correlation between health and nutrition outcomes and GDP. So it makes sense to invest in health. And, a healthy Lagos will be a productive Lagos and a wealthy Lagos. So alongside strategies, for revenue generation, there should also be a focus on expenditure management. So it's not just about allocation, it's about release, and more importantly, utilization. Are the resources used for the intended purposes? How do we also leverage available donor funds, to get the additional fiscal space? A lot of donor funding came as a result of COVID. So how do we repurpose it to improve service delivery, essential service delivery? How do we strengthen the health system so that, the rising tide can kind of float all boats? The Basic Healthcare Provision Fund also provides, has a potential for strengthening PHC delivery, and that should be operationalized. And then speakers have alluded to health insurance. The Lagos State Health Insurance is currently being operationalized, and that will definitely improve access to the poor and vulnerable so they don't suffer any financial hardships. And then I would also like to touch on efficiency gains, because it's not always about the money, it's about making sure that the little resources you have are used efficiently. Because we know that 30 to 40% of healthcare resources globally are used inefficiently. There's a lot of wastage there. So we need to strengthen public financial management systems. And then we also mustn't forget, the big C, which is corruption. And, government should take a much stronger stance to dealing with this. And of course, public and private pooling of resources. Other speakers have spoken to this. Government cannot do it alone. So we need to pool resources, through PPPs, through both the public and private sector. And luckily, the pandemic has given that opportunity to have that systematic relationship with the private sector. And I would like to just call out COCAVID that contributed or leveraged over 63 million for the first phase of the pandemic. Without the private sector, I guess the narrative in Nigeria would have been very different. And I know they are currently mobilizing resources to enable Nigeria to secure vaccines. Okay. So I think I would end here.
Thank you, Caroline. I want to take a question from the floor now. From the, is there any question? Any question? Can you, or comments? Okay, can someone pass the mic to Dr. Idris for a comment?
Yeah, good afternoon, ladies and gentlemen. My comments, they go this way. I think over the years, we've been discussing the challenges in the health sector. A lot of things we said here today are not necessarily new. And I think the COVID pandemic is giving us an opportunity. Oh, my name is Jide Idris, former Commissioner for Health, Lagos State. Yeah, to continue, I think the COVID pandemic is giving us another opportunity for us to seriously address the health sector in a faster way and devoid of all, what do I put it down, challenges we encounter. And I'm just going to highlight a couple of things. One of them has been said by Oshewe and I think Claire and even the Commissioner, the governance issues. I think governance actually creates the pathway for us to make that leap that we want to make. We have policies, we have regulations, we have laws. Some of them are Some of them are obsolete. I think it's about time we review this in the context of current thinking. That's one. Two, human resource is a major issue. Sorry, under that policy again, there needs to be a reform of the public administration in the context of the health sector, because that's what I think is a major challenge. There are challenges within the civil service structure that actually slow down your process or progress in the health sector. Two, we've talked about investing in the systems. Yes, there's no doubt about that. If you look at the health accounts of Lagos, not the country, like Claire said, in most countries, the health sector, in fact, the US now, the health sector is the largest employer of labor. If you look at the contribution of our GDP, the contribution of health to our GDP, in Lagos State, it is less than 1%. So we still have a long way to go. That's one. So health accounts, again, are issues that we need to look at for Lagos State, because there are tools that will help us in leapfrogging what we want to do. Human resources is an issue. It's a major issue. And to me, it's another epidemic ongoing. You have severe shortage of personnel in all the ramifications. There are people coming from outside now, even taking away the meager numbers we have. Then I talk of training and reorientation. If you want to reorientate in the context of technology, like Deola said, I think our people, current and must be in alignment to what we want to do. So we have a lot of work to do. One of them, again, has to be remunerations of our current health workers. It is peanuts. If you want the value for your money, then we must be able to invest in it. And Lagos State, I've always said it, Lagos State has the opportunity to lead in this country. Because that will stem the migration of our health workers out of this. The last bit is health literacy. There is nothing we can do if we cannot get our community involved we want to do. Now they say prevention is better than cure. And that's why I say that we need to spend more on health promotion and disease prevention. If you look at the same health accounts, less than 5% or 9% is spent on preventive medicine. Every other is on curative that is not regulated. I will just stop for now. These are my issues. Thank you.
Thank you, Dr. Idris. I'll come back to the floor. Please, I'll come back to you, gentlemen. So, based on what Dr. Idris said, I want to come back to you, Tosin Wanshewe. So I was talking about the Overton window, which the Commissioner mentioned in his presentation, which is essentially the broad spectrum of policies that are acceptable at any point in time. And Dr. Idris just buttressed that point of starting with governance, and that was the second pillar in the Commissioner's focus on resilient health systems planning and governance. Now, given all the beautiful things you said that we need to do in your first answer, Tosin, what policies, what direction, what specific areas do you think we need to tackle? Hello, Tosin? Okay, maybe Tosin can hear me. So I'm going to focus on HRH and task shifting and sharing Iyong, are you there?
I've just been on mute.
Oh, you've been on mute. Okay, Tosin. Did you hear my question?
Yes, I did.
Okay,
yes,
so what broad spectrum of policies do you think that we've not been able to pass through, but given everything that we've done now, would be acceptable and would help us move forward quickly?
So I think I will talk about a few things very quickly. I will talk about promotion of medical systems. We need to create policies that will, bring about the development of, healthcare, personnel, in the country. We need to look at whether there are constraints, or at MDCN, level, whether there are constraints at NUC level, but we simply need to accelerate, the rate of production of medical staff. On infrastructure, there are two things. People have talked about healthcare, and there is clearly, about technology, there's clearly a need to democratize accessibility to healthcare, through the use of technology. Whether we're talking about telemedicine, we're talking about electronic medical records, centralized electronic medical records, which can, actually bring about an early diagnosis system, predictive system in our various communities in terms of disease outbreak using, artificial, intelligence. And then lastly, we need to have incentives driven centrally to encourage, foreign direct investments into healthcare, in the country. This is critical. Especially, as, we've talked about the huge capital that is required, to be brought in, to bridge the gap in infrastructure. So today the central bank has, some credit incentives. We need to expand this, and we need to continue this, for a long time. And I think a lot of these things can be done as a collaborative effort between the various arms of government and the private sector.
Thank you, Tosin. I'm going to come back to you, Claire. Tosin has said some things, incentives, HRH. But let's get down, and you operate like in this market, you understand this. Let's get down to the reality of merging what Tosin said and the concerns that Dr. Idris raised, right? So we said there's a human resource for health problem. Yet, we don't have enough doctors. So Tosin mentioned that we produce only 3,000 doctors a year. And we have so many PhDs, right? So if I said, for instance, that how about we need task shifting and task sharing or nurse-led PhDs, will the policies on ground right now support that? Will it happen? I mean, I want us to talk about real solutions that will affect us. Give us examples of areas where incentives need to be put in place to ensure that we can achieve the kind of modernization that we want, that the Commissioner has presented to us, that can be achieved at primary, secondary, and tertiary care.
Thank you very much, Fisayo, and for that question. Just before we started, I want to just make one comment. And you did ask me before, what was the correlation between GDP and healthcare? And the first question to any of us here is that if you look at the losses that every country, every state has made over the last 1 year, it's first and foremost productivity. But then what has helped us with the rebound has also been the leveraging on technology that shows that some kind of disruption can actually lead to innovation. And I think that's one of the learning lessons for us here. And when we leverage on that innovation, we can now see the productivity get GDP back. So without a healthy community, we will not be able to be productive. We will not be able to make a difference. And as a mega city, if we do not have access to quality healthcare, then we'll have challenges in our hands. So to answer your question directly, what are those things that can be done to make a difference? What are those incentives that we can put in place? I think the first incentive that is required is the fact that we need access to affordable and long-term capital. The biggest challenge that healthcare faces is financing. The existing financing mechanisms, although yes, central bank has intervened with 100 billion naira, 100 billion naira is nothing compared to the infrastructural deficit that our country has. Lagos State, with over 25 million people, in the next 10 years, a huge growing population, we have a huge population bulge, we need to be able to do something disruptive. So it is important that we get access to finance right, and we must be innovative. And that's where PPP comes in, combining the forces of both public sector and private sector. Capital budgets of government, especially Lagos State, will be dwindling, but we can leverage on the access to capital in the private sector. But private sector will only bring money if I have the right enabling environment, I have the right incentives, I have an ease of doing business, my capital is safe, and that as government changes every 4 years or every 8 years, my investment doesn't change alongside it. So we need to have the right legislative framework, the right regulatory environment, the right kind of policies. Now, what are those kind of policies that we're talking about? People-friendly policies that we're all at the table, and we co-develop the policies that are required. In the past, policies were made and given to you to follow. But what we're seeing now, especially with the present government, is that we have a more active, proactive government that engages. In fact, if you look at the pandemic as an example, right from day one, even before it became Herculean for us as Lagos State, Lagos State Ministry of Health engaged private sector constructively, looked at private sector, private health sector, what needs to be done. We tabled everything that was required. We agreed where our strengths are, those that could provide financing, those that could provide resources, that could provide time, those that could leverage on technology, and we leveraged on people's core competencies, and I think that is something that we need to do. If we go down to the level of primary health care, 300 primary health care centers, infrastructure doesn't make it happen. What makes it happen is people, 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 and then equipment. Now let's start with the people issue, with the deficit. In the next 10 years, even if we graduate everybody from our existing universities as doctors, nurses, and pharmacists, we will never be able to close the human capacity, the human resources for healthcare divide. So we have to be disruptive and leverage on technology that we're able to do so. So we need laws, we need policies that understand the importance of leveraging on technology. We need the infrastructure and all the other conferences that we've had prior to now about laying cables, about access to the internet, about education and educational capacity building. All these enabling environment makes healthcare also enabled. So we don't work as healthcare in a lacuna. We have to be able to fix the entire system. That could be a huge opportunity for us to take over existing primary healthcare centers, not necessarily take over, let's say concession. You take the leverage on the competencies of the private sector, we get access to capital, get innovative financing, put in the mix there, and within 6 months, we could go from moribund PHCs to fully functional PHCs with 24-hour care. Let's go on to even more tertiary care. In addition to the fact that we have communicable diseases, we have non-communicable diseases, unfortunately, as one of the challenges we face. So diabetes, cardiovascular disease, cancers are on the increase. The cost of setting up hospitals today to government will be Herculean. But in partnership with the private sector, we can set up the necessary infrastructure that is required. Do innovative modeling, innovative financing, including bringing in OEMs. I represent 26 OEMs in the country. With the partnership with each of these OEMs, they bring the entire balance sheet to bear in Lagos State. We can do leasing of equipment. We can bring in the expertise and have foreign direct investment in country. We can do concessioning over a period of time to give access to quality care with world standard. $1 billion is being lost on medical tourism every year. This is what goes through the official system. When you and I go to hospitals anywhere in the world, it's not going through the official system. We will need to be able to make Lagos State a mega city, a medical tourism destination, not only for Nigeria, but for West Africa and the sub-region. Take advantage of the existing African free trade zone right now and have free movement of people and services and have dedicated hubs and do radiotherapy, do cardiovascular care, do all the various things that we do. We leverage on technology and do robotic surgery. We have a huge diaspora, We need incentives to bring the diaspora back, to make it a level playing field, ease of doing business. Yeah. There's a lot that needs to be done, but we need to co-create, and that's the real word, co-create the right type of enabling policies that unlock the potentials of the private sector, make it easier to do business, de-risk the transactions a little bit, share the risks in the right way. Government has the people, has the populace, has the infrastructure, has the land. Private sector has the expertise, the technology, the access to capital. It's a great marriage if we get it right and we have the right enabling policies.
So what I hear you say, again, is that great marriage that can be
It is important that we have strategic public-private partnerships with a clear policy, the enabling framework, And this will help to open up the sector,
Okay.
to bring in more domestic investment in addition to foreign direct investment. And I say that on purpose because we have a lot of Nigerian entrepreneurs that are ready to co-invest in country if given the right type of incentives, the fiscal, non-fiscal incentives, the tax breaks and pioneer status and things like that.
Okay. Thank you, Claire. So I'll take another question from the floor. Yes, you raised your hand first, actually, sir. So then I'll come to you, Eyong. So please get ready.
Good afternoon, everyone.
Good afternoon, sir.
I'm Dr. Wale Ahmed, Honorable Commissioner for Local Government and Community Affairs, Lagos State. I've listened with rapt attention. I agree with virtually everything that has been said here. People have spoken well. So I want to say, like in our normal parlance, to stand on existing protocol. So by that I mean I adopt virtually everything that has been said. But I have something I want to talk about that we don't seem to be placing emphasis on. It's good to provide infrastructure, provide appropriate and adequate manpower, set up people-oriented system, and other things that will in fact be required to respond when people get sick or need medical help in one form or the other. All this is good. They are in fact necessary. But this aspect seems to attract all the attention. If you look at what we have been talking about, with the exception of my brother, Dr. Jide Idris, that mentioned a bit of what I'm trying to talk about now. This aspect seems to attract all the attention. But while we keep at this, I want us to start paying a bit more attention. I want us to start paying a bit more attention to the preventive aspects. And one simple, basic tool is health education. I don't want it to be confused with medical education. That's trying to train to be doctor or nurse or pharmacist, but health education. Educating the public on simple lifestyle changes, dietary habits. What can they eat to help them? What should they avoid? Even sleep, something that we overlook. Exercise. Our environment. We should start targeting achieving a reduction in the number of people that will eventually need medical help in one form or the other. It should form a major target on our list. All who have been to medical school will remember that even there, the medical education focused more on diagnosis and treatment. That is the curative aspect. There's a course called community health. That's the one that most medical students never used to take too seriously. And we never pay attention to even after graduation. And to my mind, it seems to be the most important tool now and the most important topic now. So this mindset of patient management. How many bed space per particular percentage of population and all that. It has to change. It's good so that we can respond when necessary. But that mindset has to change. Our Ministry of Health, under the Honorable Commissioner here, needs to be empowered, and the ministry empowers a particular department. Create it if it's not in existence. Empower it if it is in existence. That will be charged with the responsibility of educating the public about enhancing their health, what they need to do, and what they need to avoid. And this should not be left for the Ministry of Health or the government alone. Let's have non-governmental organizations, and in fact, other peoples of good conscience. Let's have them channel their energy and resources in this direction. Let's hear more noise about that from most of the NGOs we have. And please, I beg you, let this form a major topic the next time there is an opportunity to have this kind of discussion. Thank you.
Very much. Thank you very much. I'll come back to the floor briefly. I just want to get Enobong Abasi, are you there? I want to pick up on One Health because of what the Honorable Commissioner just said, as a way of preventing future pandemics, or a way of having a lifestyle that ensures that very few people need treatment, as a way of changing health-seeking behavior. So you look at human health, animal health, and the environment itself. What do you think we need to be focusing on regarding One Health right now? This question is for Abasi. Iyong, I'll come back to you after Abasi. Hello? Okay, he's not there. Okay. So Iyong, I wanted to go from what Claire just said about upgrading secondary, tertiary, and even primary healthcare clinics, right? So let's assume we have the policy aspect right. How will it work?
So hey, Fasaya, thanks for the question. There's a lot of feedback on that line. Hopefully you can hear me clearly. Look, I think that we need to look at how we can standardize and reduce the fragmented approach to infrastructure investment in healthcare. Scale and standardization is very important. Within GE at the moment, we're focused very much on lean principles. As we know that standardization or standard work, you can increase efficiency, reduce costs, and deploy at a wide scale so that you can then plug in additional services, resources. So as an example, if you build infrastructure at scale, similar units, similar size, offering standardized ways of working, you can then effectively roll out training programs to staff in a cost-effective way, utilizing digital virtual technology, which means you save on costs. And then the outcome of that, you can have a workforce that can literally move from one facility to the next, knowing that type of equipment, type of clinical services, SOPs, ways of working will be similar wherever they work. So when you do that in that way, you are able to move quickly. Modular designs. We've recently done a project in Zambia where they've utilized modular systems in primary healthcare, very easy to use, very easy to construct, and very fast to deploy. You deploy standard pieces of equipment that everybody can utilize and use wherever they are. And you're able to provide improved services to the general public. So for me, it's relatively straightforward. Fragmentation causes costs. It causes difficulties in being able to train the workforce. And if you go to the standard scaled approach, you can move faster and quicker.
Thank you, Young. So I'm just going to come back to the Honorable Commissioner because our time is up on this. To give us some closing words, he's heard a lot and I've seen him taking a lot of notes. To give us some closing words, our time is up, sir. Up, we can't take any more. To give us some closing words on how he feels that we can put this all together and what we've literally sort of harnessed from this entire discussion. Thank you, sir.
Thank you very much, Dr. Fisayo. Very, very important points made by all our speakers and from members of the gallery. I'm sure there are so many other points that people can make. But I think the key points that have been raised are issues around, numbers of beds, doctor, medical fraternity populations, brain drain, the small number of medical schools that we have in the country, the consolidation of the fragmented healthcare systems, health priorities that we've gleaned out of COVID. And one thing that keeps coming back is this public-private partnership. And I think COVID has really opened our eyes in this regard. The private sector was brought into the COVID response very early in Lagos State. As a result, we've been able to share the burden. We've been able to share the cost. And we've made both testing, treatment, and digital technologies more widely available to every sphere of the community in Lagos State. The other thing that we've done as a state is to create that enabling environment for the private sector to come in a way that's very simple, easy, and lacks bureaucratic hurdles. What we describe as ease of doing business. And I think Mr. Governor has been very instrumental in this and making sure that, there are no obstacles. If the policy is right, just go ahead. There's no time to waste under these kinds of circumstances. We're always under pressure. And this has worked very well. And I think it has set a tone for us moving forward on how to really engage with the public sector. I think the issues around governance are so important. Dr. Jide Idris talked about our health reform laws and how we have to reform the health reform laws because they need to keep in line with the changing environment. 10 years ago when the laws were written, or 20 years ago, the environment is totally different now. And I think not only do we need to update those laws, but we need to write new ones and we need to harmonize them because sometimes these laws, they don't speak to each other. Another significant issue that has come up is the value of healthcare to the GDP. And I think that, again, is something that we have a priority on as the Ministry of Health. We want to, for starters, we want to make health neutral. In other words, government will stop spending as much as it is doing on health and with time go from neutrality to being a positive contributor to the GDP. And this is the mission of this dispensation. I understand my time is up, so I just want to thank the moderator, all members of the panel that are here, and virtually thank you very much for your time. We've had very distinguished members of society within here physically. Thank you very much for your comments. I know all of you couldn't ask all the questions you wanted to, but we're available. You can send us the questions and we will take note of them as we develop the health blueprint for Lagos State. On that note, have a pleasant afternoon and thank you once again.